Mr. Chairman. Thank you, Secretary, for being here today. I'd like to first thank you for your work. Thank you for your willingness to do this. Thank you for your courage, because taking on entrenched systems does take real courage, and I think future generations will thank you for the work that you're doing today. I want to talk just two quick things. You've spoken extensively about the role of diet in preventing chronic disease, and I have two specific policies, bills that I'm working on that we've talked with the department about, but I'd love to get your public comments about them today. The first is food as medicine interventions, like produce prescriptions, medically tailored meals, which there's growing evidence that they can really improve outcomes for patients with chronic disease. So I think there's a role for these approaches in federal health programs. And of course, you know, CMMI is created specifically to test new healthcare delivery models that improve outcomes, lower costs. And I appreciate that under your leadership, CMMI has started to prioritize prevention-focused models. So I've been working on and plan to introduce actually this afternoon a bipartisan bill that would test a bundled payment that provides certain chronically ill patients with a comprehensive package, access to healthy produce, nutrition counseling, remote monitoring, with the goal of preventing disease progression and reducing avoidable healthcare costs. Just like to get your reaction to that, and love to have the continued support of the department for a policy like this.
I mean, we have the highest chronic disease burden in the world. The Congressman was talking about the deaths from infectious disease, which are a couple of thousand a year. 90% of the people who die, the 3 million people who die in this country, die of chronic disease, and nobody's paying attention to this. And all of these members have ignored this for as long as they've been in office. This is the real threat to American health. In fact, during COVID, we had the highest death rate of any country in the world. And when you ask CDC, why is that true? They say, well, it's because we're the sickest population. The average American who died from COVID had 3.8 chronic disease. Well, what was killing them, COVID or the chronic disease? You have to understand chronic disease, infectious disease has a very hard time killing a healthy person. It kills people with chronic disease. And I'm looking forward to, you know, up to 70% of type 2 diabetes can be reversed, and people can even lose the diagnosis simply by changing their diet.
Yep. Well, thank you. I do want to bring up one additional piece of legislation that we're working on. You know, food manufacturers are moving in the right direction due to your leadership on reducing additives, reformulated products, responding to consumer demand for healthier options. There's still a gap, though, in what's in the generally recognized as safe or GRAS pathway, where companies can self-determine a substance is safe. They determine that themselves, often relying on their own expert panels with limited transparency into potential conflicts of interest or underlying data. So that's another piece of legislation I'm working on. I think we should establish clear standards for self-GRAS panels, strengthen public confidence in our food supply. Just wanted to get your thoughts. Do you believe reforms like that are necessary?
That's absolutely critical. We have finalized in my agency closing the GRAS loophole, and that regulation is now going through the interagency process. We're a little bit hobbled in what we can do, and Congress can do much more. So my office would love to work with your office on getting a much stronger bill, much stronger regulations. The GRAS loophole has been hijacked by the food industry. And because of that, we have 10,000 ingredients in our food. In Europe, they only have 400. And most of those have never been safety tested. We don't even have a list of them. We have no idea what they are. It essentially allows the industry to put in any chemical they want, any chemical they devise in lab, into our food without even the slightest regulations. And that needs to be changed if we're going to make America healthy again. I appreciate your help and your leadership, Congressman.
Thank you. Look forward to working with you on that.